Hello, everybody, and welcome back to The Good News. I'm your host, Elisabeth Gunawan. You have just heard For All We Know by John Paul Muir from his album Cornerstone Suites. And the song is all about an acceptance and the peace that comes from acknowledging that we don't know everything about what's going to happen, and that's okay. The suite is available to buy on iTunes and to stream on all major platforms, and you can also find out more about JP on his website, johnpaulmuir.com. There is a ton of exciting stuff this week. We've got the launch of the WeAreGoodenough magazine online, edited by members Sarah Gibbs and Claire Hurley. Also, we have the launch of the psychologically informed storybook, There's Something in the Air, by members Anjui Wu, Jasmine Katia-Mintov, and Hida Jaliskan. So between all that and the accommodation charges table, there should be plenty to keep you intellectually and emotionally provoked. Our next guest is our very own Wu Anjui. He graduated from National Taiwan University School of Medicine back in 2013, spent 1 year in clinical medicine before working as a business consultant for various companies. He moved to London to work on a PhD specializing in clinical cancer research. And after passing his final PhD viva in December, he's now a full-time junior medical oncologist at UCL Hospital and also a postdoc research fellow at UCL Cancer Institute. And of course, with the pandemic that's still raging across the world, people like Anjui are really at the front lines of what we're doing. So please help me in welcoming Anjui. How are you?
Hi, good. So, good morning, and thank you for giving me organizing this stuff in Good Enough. It's been a really pleasure. I mean, having people still trying to build more in this community. Really happy meet you guys and to be sharing some of my experiences, whatever you want. Yeah, and the Sunday morning, Easter morning.
No, absolutely. It's an honor, and I'm sure it's perilous to be part of a podcast with everything you're doing. But I guess my first question is, obviously the past few weeks have harbored many changes for everyone, but I'm sure especially for you as a junior doctor. So can you tell us about how the journey's been? How, especially at work, some of the things that are at the forefront of your priorities have changed? Because I understand that you actually, you're an oncologist, but recently you've been put in charge of the ICU, which is now basically full of patients that are struggling with COVID.
Yeah, things change constantly, and I mean, if you follow the news in the past, month, every single day there's a news release about how this virus pandemic thing hitting the UK. So UCL Hospital has organizing a specialized COVID ward. So which means we change some of our arrangement inside the hospital, and for hematology and oncology department, some of our patients getting COVID, and because by having their hematology oncology problems, they are more so-called vulnerable. So if they do have the virus infected, what we need to do is we need to put that in a specialized ward unit, which I'm currently working on. So all those patients have either hematology or oncology diagnosis, and they also have the virus. So in terms of the whole population, there are those people who are so-called vulnerable, so who have higher chance of developing a secondary infection or potentially will probably suffer from that. That's why we need this specialized unit to support those patients.
I see. So the specialized unit you're working with basically are already people who are extremely vulnerable in the sense of being immunocompromised or actually having a previous diagnosis and I guess are already in some ways existing patients being cared for by the hematology and oncology departments.
Yeah. So we prioritize those patients, but still there are few, general medical patients. They are just having some diabetes or they diagnosed with COVID, because the policy currently in NHS is even if you get infected and you are fit and you don't have any symptoms such as you feel like chest pain, tightness, or short of breath or high fever that you can resign. So we still suggest most of people to go home and self-isolate. You only come to the hospital if necessary. And so I would say 80 to 90% of our isolation intensive unit, currently I'm working at our hematology oncology patient because, as you just said, some of them maybe still having chemotherapy, maybe still have targeting therapy. Some of the hematology patients are still having transplantation. They're just recovering from the bone marrow transplant. So their immunity is quite weak in general. That's why we probably even put them in the isolation unit to be to have a closer monitoring. But most of young adults or even like just general adults, if they don't have any severe symptoms, they can go home and stay at home.
Well, I'm curious also if you, because I guess a lot of what we're seeing on the news are kind of images of how the ICUs look in Bergamo and in New York. And it's funny because I was reading in the New York Times today, they actually said that it's in a way more difficult for a journalist to get posted in an ICU than for them to have been posted on one of the planes to Iraq during the war, just because of all of the complications with the current situation. So perhaps could you walk us through what a regular day kind of looks like for you on a work day? How is the situation like, and your hours, and do you have everything you need to be taking care of these patients and so forth?
So let me just try to walk you through. So in our world, we are intensive unit, but it's not an ITU where they're using a British word. In US will be ICU. So they do like not only ventilation, they also do intubation. So put a flexible tube inside patient. Currently, we're not allowed to do it in our ward yet. So we are not complete like ICU setting, but we do provide the respiratory support such as oxygen and the ventilation, but just not invasive ventilation, which is they normally do in ICU. So because those patients are confirmed COVID, so sorry, I'm using COVID just to name it coronavirus 2019, which is the official term. So the day job, because they confirmed COVID, so all our beds are isolation, which means the patient cannot come out, and those patients are not allowed to have any visitors. So each floor, and currently in UCL hospital, only 4 floors are, they call COVID wards. So the whole floor are full of COVID patients. The patient have COVID infected. So all the doctor or nurses need to be specialized in each floor. So for instance, I work in currently T8, so named as Tower 8 floor. I'm not allowed to go to other floor just because of the infection control purposes. When you enter, the policy currently in UCL is only key workers are allowed to enter the ward and with COVID patient. So when we enter, all the patient will be isolated in the what we call siren. So siren is basically double dooring. The first door when you open, and then to see the patient, you have to we call it donning. It's kind of funny. Just basically just a place where you can wash your hand and wear the PPE and stuff like that. And the patient will be in behind the second door. Only the doctor, like such as consultant or me, or nursing staff will be allowed to go in. And the patient to contact us can only using phone, or there's a bell they have to ring. They can't come out of the room. All the food will be delivered to them. And then we basically it was the setting. And in terms of how the clinical job was done, to be honest, to me, it's not so different. Basically, we give patients what they need. So when we first place in this unit, we feel like, oh, things are so different and we have to do things in a very different way. But actually, some of the consultants just suggest that we should not, we should do whatever we feel is right for the patient, just like we do normally in the war round and then caring for the patient. We should not change the thing we normally were doing. For instance, is listen to the chest, organizing ultrasound or X-ray. We probably have to be careful that patients have infection, but there's already a lot of setting it's being set for those COVID confirmed patients. So we should not change, our practice too much just because they have infected this virus.
That's interesting because basically not leaning into being too reactive, but actually, like as a doctor, still consider, especially because I'm sure these cases are even more complicated, like you said, because not only have they tested positive, but they're also dealing with a lot of these previous diagnoses. I guess something that I'm curious about is perhaps for you, especially as someone with such a diverse background, having studied medicine and having worked as a business consultant, having done a lot of research into oncology and also caring for patients. What have you learned, in terms of being in the medical profession from just the experience of the past few weeks?
Yeah, I initially, when I know the outbreak and I know it's hitting Italy so bad, I expect it will probably happen in the UK very soon. So at that time, I still feel like a bit puzzled about, we don't know much about what's going on. I feel a bit nervous and also to be honest, a bit excited because it's probably one of the chance of a lifetime. I don't know when there will be a next outbreak, but as a doctor, you're always waiting for those big moments. If people need you and they need your clinical judgment, they need you to sometimes just being there, talk to them, saying this is okay and don't be too worried. It's probably not you feel bad not because of having COVID, maybe something else. You need your clinical judgment and you need to react quickly. It's always been trained, as a medical student or as a junior doctor. And this is actually I won't say the right timing to show like how good you are, but it's also a right time for us to step in. Do you know what I mean? Because suddenly I feel like a previous job like research or doing business, it's now dealing with this pandemic, I just feel like so precious, like having those medical training and a lot of like we beef up our knowledge just to prepare for this moment because it's something like for me, I never experienced a pandemic or like such an intensive medical need in any other scenario. So I feel nervous, me being infected or my colleague, some of them are actually calling sick in the past few weeks. But at the same time, I also feel excited because we are learning something we didn't know, we don't know before.
Oh, absolutely. I think you're really realizing that doctors take that Hippocratic oath and it's really being put to the test, right?
Yeah.
I think everybody, me included, have just really realized how important it is, the roles that like these doctors and nurses play. So I think I'm sure everyone agrees and with me in thanking you for everything that you've been doing as well and everything that your colleagues have been doing. I guess
Thank you.
something that perhaps I'm curious about because I'm sure even from UCL Hospital, you guys have been hearing the clap for carers that people have been doing for the NHS every Thursday at 8 p.m. But in addition to that, which I think is a very touching expression of our gratitude as a nation to you, what are ways that you think other people can actually help, both those who are able-bodied or even those who might have to choose to isolate at this time due to being immunocompromised?
Oh yeah, so first of all I have to thank you for all the people who support NHS. It's my I don't think I have like much NHS experience, but in the past few weeks people be extremely supportive. Not only the all the senior consultant, they've been, stepping down and then helping us with all those questions and doing some, some night shift, which normally we will have to do as a junior doctor, but because of short of staff. And also those non-medical staff, like people giving us a lot of food and then giving us space to rest. So it's just because of the people here are just so understanding of like the NHS mission. So first of all, I just thank you like for those support. To be honest, I think for non-medical staff, if not involving in any of the medical care, I guess the best thing so like current to this point is just to stress again, like self-isolation is so important and stop spreading out the virus. And if you do have symptoms, go to call the NHS hotline, which is 111, I believe, and then speak to either to your GP or the hotline to know whether you should be coming to the hospital and then get tested. So in the hotline, there's a triage system, and this triage system, they will go through all the questions with you and then to advise, well, whether you need to come to the acute medical unit to be tested, or it's better for you to stay at home. Because to be honest with you, currently there's no very strong evidence of which medication we are giving to cure this virus. Globally, we don't have a very clear medication or treatment guideline yet. Also, you might see from the news, there's some drugs, like a drug from Gilead from the US called remdesivir. There's some hydroquinone drugs we're using to cure malaria. But currently, there's no strong evidence giving this medication the patient will cure. So still, if you have symptoms, the best way currently is stop spreading to the new people who are currently healthy. So self-isolation and self-testing is probably everybody need to be 100% on top of this, because this is the only way you can help save yourself and save the people around you.
Absolutely. Yeah, and I think what's amazing actually about being part of the Good Enough community is obviously with everything that's going on with the pandemic, you shouldn't be taking information just from any old person. But for the most part, in terms of the credentials of the people we've been speaking to, it's like within the scale of 0 being your Uncle Sam and 10 being a PhD in clinical medicine. We're talking to someone with a PhD in clinical medicine.
Yeah.
Well, thank you so much, Anjui. This has been really, really great. And thank you again just for everything that you do. And I hope you enjoy the rest of your Easter Sunday.
Yeah, thank you so much, Isa, and thank you for organizing this, and hope you see you guys soon, and we will back to normal life very soon. Yeah.
Okay, you guys, if he's in the hallways, don't forget to give him a mental high five, not a real one.
Yeah. Thank you. Cheers.